Thanks very much for meeting with me tomorrow and agreeing to help me with this video project.
You're very welcome.
Now, my need really is just expanding my knowledge on the nursing profession and building up on my communication skills. I understand that communication in the nursing field is important between yourself and the patient and yourself and other colleagues. So I just wanted to focus a bit on your field of work, which I believe is nursing in aged care.
Yes, that's correct.
Cool. So can you just tell me a bit about your role in communication and why it's important and how you use it on a day basis?
Yes, well, communication is very important and you do find yourself using it on a daily basis. Within aged care, I find myself having to talk to doctors, staff and other colleagues, as well as all my patients and clients. Now, it's important to communicate with your doctors to provide the best care you can for all your patients and all your clients. Staff communication is also very important in providing efficient care to your patients, but also as well as working in a team on a daily basis, because teamwork obviously in nursing is also very important. But mostly I find it is very important to talk to your patients. You want to build up a rapport with your patients and trust with your patients, so introducing yourself to them is also very important, as well as explaining each task before you do it.
Yeah, I understand that. So it is really important to build that relationship before you do them tasks and help them with their needs and help them every
Overall,
day.
yeah, definitely.
So what happens because communication with elderly people is really important, but what happens if it's not used effectively?
Okay, if it isn't used effectively, you can suffer from it, because obviously you don't build up that trust with your patient. It is very important to get your patient to trust you, so you can provide the best care you can for them, but also so they can talk to you. So if they have a problem throughout the day, they won't hesitate to let you know that they're in pain or that this isn't working well and so on.
So making them comfortable around you.
Yeah, definitely.
Yeah. So one thing I struggle with when I communicate with people is the difference and balance between talking too much and listening. So is that a real key element in working in aged care, the balance between listening to your clients and talking and telling?
Yeah, definitely. Like I said before, I think it's very important to communicate with your patients. So introduce yourself, let them know what you're going to do. Then it's also very important to ask them if they've got any questions. Let them talk to you and therefore listen to their needs, listen to what they want to do, if they want to go for a shower or if they're in pain and need medication. So the balance between them two, I think, is very important.
Yeah, that's interesting. So it's really good to make yourself not assertive, but known to them, so they don't feel kind of shut out. And so you visit houses, so it's good to build a relationship in the first bit before you enter their home and you do all your needs to them.
Yeah, definitely. Because I work out in the community, I do travel to people's houses, and it can be very daunting having someone rock up to your house that you don't know and expect to invite them in and do wound care or take them for a shower and things like that. So therefore communication right from the get-go is very important. Even just a phone call before I go to say, hello Mrs. Jones, it's Tamara, the nurse from St. Mary's. I'm on my way. I'm going to be there in half an hour, just to let them prepare and get ready.
Comfortable, yeah.
Yeah, that's
so
right.
It is obviously important in all of the nursing and all of the health professions, but especially with elderly people.
Definitely.
It's better to, step out everything and make the procedure easier for them.
Yes, definitely. Because sometimes as well they don't understand what you're doing or what you're talking about.
Right, so I really appreciate you helping me out with this today. It's really given me a good understanding and a good idea about my role in nursing and your role and the role of communication overall. So thank you really for that.
Yes, you're welcome. It was my pleasure.